I'm really excited to present the results of our study entitled Predictors of Durable Remission for Following Successful Surgery for Cushing Disease, results from the Multicenter RAPID Registry. RAPID is a multi-center registry looking at skull-based pathologies as well as pituitary adenomas, and currently involves 16 sites and is continuing to grow. These are the various disclosures for this particular study. Cushing's disease is a rare disease with approximate incidence of 1 to 2 cases per million and higher mortality compared to the general population, which decreases as hypercortisolemia is put into remission. So identifying predictors of remission for long-term has significant benefits for patients. We sought to explore the data from a multi-center group of 11 U.S. centers of excellence looking at pituitary tumors. Data was from 2011 through 2023. We analyzed demographic and surgical variables, and our primary outcome was looking at remission rates and timing. And secondary outcomes were looking at predictors of remission. Remission was defined individually at each center using their own internal criteria and laboratory studies. The demographics of the study is shown here. In terms of remission, we had 288 patients. 95 patients showed recurrence. There was no difference in age, but there was a significant difference in NOS score, where a score of 0 was more associated with long-term remission. Prior treatment on our univariate analysis showed increased likelihood of remission in patients that did not have prior treatment. And tumor volume, smaller tumors, was predictive of long-term disease remission. We further explored those results because follow-up is important for predicting remission. And when we looked at prior treatment, we actually found that it did not have an impact on long-term remission outcomes. And similarly, we looked at NOS score in terms of the impact that time and follow-up has on it. And we did show that after controlling for other factors, a NOS score of 0 was predictive of long-term remission, similar to age as well. These are actuarial survival tables of remission rates for Cushing's disease by NOS score, something that would be very difficult to calculate without multi-center data to be able to get enough sample size to be able to put a table like this together. And again, showing that NOS grade 0 score showed 81.5% remission rate at 5 years, which could be data that could be useful for patients in identifying their prognosis. We also looked at surgeon experience. We did not find that surgeon experience had a impact on remission rates. This has been an area of study in the literature, and we sought to explore it as one of the factors here. In terms of perioperative features, most patients underwent endoscopic approaches, while that on univariate analysis showed a greater impact with remission. That was more correlated to surgeon follow-up rather than endoscopic or microscopic use. Surgeons that had greater experience tended to use more microsurgical approaches, had longer follow-up with patients, versus newer surgeons that tended to use endoscopic approaches and did not have as long a follow-up on their patients. So it's really the follow-up that impacted remission rates rather than the surgical technique or the experience. And this is a depiction of surgical experience showing that once you factor follow-up, there were no differences in experience in predicting remission rates. In conclusion, NOS grade 0 patients and younger patients were more likely to achieve better long-term remission. Surgical techniques such as endoscopic or microscopic approaches did not play an impact, but we need more data to look at surgical nuances and strategies used in surgery to see how those impact long-term outcomes. The strength of this study is that it's multi-center. It provides actuarial data that can be used for further studies and benchmarking, and it looked at multiple surgical and perioperative factors. The limitations are that these are centers of excellence, and the results may not reflect the findings in every hospital in the U.S. The follow-up was limited for higher grade NOS tumors. And again, some of the surgical nuances were not available for this study, but are an area of focus for our future studies. I'd like to acknowledge the principal investigators and study coordinators at each of the sites, as well as the Barrow Clinical Outcomes Center, which helped coordinate the data. Thank you so much for your time and attention.